Hi coders. You all knows that OASIS-E will be implemented from January 1st, 2023. So I think it is very important for all of us to understand what are the basic changes that we will be seen as home health coder in new OASIS-E. Before directly going to the OASIS-E updates, I would like to discuss some basic things related to OASIS. As you all know that, the Outcome and Assessment Information Set is a group of standard data elements home health agencies integrate into their comprehensive assessment to collect and report quality data to the Centers for Medicare and Medicaid Services. So why this OASIS is so important? OASIS is used to determine payment for some insurance, primary Medicare. OASIS measures the quality of home health care and benchmarks organizations against state and national standards. It is used as the foundation of home health care planning. Why there is need for change in OASIS? Currently the main reason for revising OASIS is to increase standardization across post-acute care settings, to uniformly collect social determinants of health data and to enable calculation of standardized cross-setting quality measures, pursuant to the provisions of the Improving Medicare Post-Acute Care Transformation Act, or IMPACT Act. So what is exactly the Improving Medicare Post-Acute Care Transformation Act or IMPACT Act? The IMPACT Act specifies that the data should be standardized and interoperable, so as to allow for the exchange of such data among post-acute care settings like long-term care hospitals, skilled nursing facilities, home health agencies, inpatient rehabilitation facilities and hospice. So how the transfer of health information between post-acute providers will be facilitated in new OASIS-E. The new OASIS-E will include a new transfer of health information item. Research shows that poor patient outcomes are directly related to medication issues. So the timeline of reconciled medication list will now be measured to the subsequent provider in next setting, and it is added to the home health quality reporting program, which will be available for all settings. Social determinants of health. The social determinants of health are the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. Agencies will now be able to collect and identify these actionable items, which should ultimately lead to better patient outcomes. By January 1st, 2023, the OASIS-E will be implemented in line with the nationwide expansion of the home health value-based purchasing model. All current revisions are consistent with the Improving Medicare Post-Acute Care Transformation Act to promote interoperability between care settings. By having identical data assessment items as other settings, interoperability will increase when each setting uses the same criteria to complete the data set. These are the OASIS-E sections. Now we have other alphabets also, with M, G and J in OASIS items. Important major changes in OASIS-E for home health coder. M0102, text under NA section is updated with word ROC, which means it is changed from no specific SOC date ordered by physician to no specific SOC/ROC date ordered by physician. M1000, marked all that apply is replaced with check all that apply, and also skip text is updated. In M2301 emergent care, here also skip text is updated. M1200, this M item is removed from OASIS-E, and B1000 is a new item replacing M1200 for vision section. M1730, depression screening is removed from OASIS-E, and D0150 patient mood interview is a new item replacing M1730. M1910 fall risk assessment is removed in OASIS-E. GG series. GG0100, few wordings are changed in this section, like all added in independent and dependent. Any added in needed some help. In independent they have changed him/herself to themself. In the self-care section they have replaced and with or. GG0130. Here in the oral hygiene remove and replace changed to insert and remove. GG0170. They have removed phrased feet flat on the floor underlying to sitting on side of bed. In the one step, curb, they have change and slash or with or. M1242 frequency of pain interfering, this section is replaced with J0510, pain effect on sleep, J0520, pain interference with therapy activities, and J0530, pain interference with day-to-day activities. And lastly M1030, therapies the patient receives at home, this section also removed in OASIS-E. Following pages will show you the M items no longer collected at follow-up. These M items are removed in OASIS-E. See this slide for old M items changed to new one. And finally these are the new terms in OASIS-E. I hope you like this information. Thank you and happy coding.